If you live with anxiety, chronic pain, migraines, autoimmune patterns, mast cell, long COVID symptoms, or nervous system sensitivity, you've probably been told some version of this. You're complicated, you're sensitive, your body overreacts. And while that may be descriptive, it's not explanatory. Because what's really happening in many modern chronic illnesses is not weakness. It's exhausted regulation. And magnesium sits right at the center of that story. Here's the paradox I want you to understand. The people who need magnesium the most often tolerate it the least at first. That sounds backwards, but it makes perfect physiological sense. Let me explain. Modern illness is a regulation problem before it's a diagnosis. Most modern chronic conditions share a few underlying patterns: chronic nervous system activation, persistent inflammation, immune overreactivity or burnout, impaired detox and cellular repair, high stress hormone output, and low buffering capacity. Magnesium is required to regulate all of those systems. But when a system has been running on survival for a long time, it adapts to tension. That tension becomes familiar, predictable, safe, relatively speaking. So when magnesium is introduced and begins to lower neural firing, relax tissue, and soften defenses, the system can initially react. Not because magnesium is wrong, but because calm feels unfamiliar. This is why people with modern chronic illness often say, "I know magnesium is supposed to help, but I feel worse." That response deserves understanding, not dismissal. Anxiety isn't always psychological. It's often mineral-depleted physiology. Let's talk about anxiety for a moment. Magnesium helps regulate GABA signaling, glutamate balance, adrenaline sensitivity, and calcium channel activity. Low magnesium creates a state where the nervous system fires more easily and calms more slowly. So people experience racing thoughts, hypervigilance, panic sensations, and sensory overwhelm. And they're told, your anxiety is the problem. But often the problem is that the nervous system lacks inhibitory support. In those cases, magnesium doesn't treat anxiety, it restores the nervous system's ability to regulate itself. That's a very different frame. Chronic pain increases inflammatory signaling, muscle guarding, nerve firing, stress hormone output. Migraines in particular are strongly associated with magnesium deficiency. That's not alternative theory, that's established research. But again, people with chronic pain are often sensitive. So magnesium has to be introduced with respect for timing, dose, form, and route, all of which increase magnesium demand. This is why one-size-fits-all advice fails so badly in these populations. Mast cell, histamine sensitivity, and neuroimmune conditions. This is where things get especially misunderstood. Magnesium helps stabilize mast cells, nerve endings, calcium-driven degranulation, stress-mediated immune responses. So in theory, magnesium should help, and long-term, it often does. But in people with mast cell or severe histamine sensitivity, the gut is reactive, the nervous system is primed, and the margin for error is small. So oral magnesium may flare symptoms, not because magnesium is wrong, but because the delivery system is wrong. This is why topical magnesium, baths, and ultra-low dose strategies matter so much in these bodies. Sensitivity is not fragility. It's low tolerance due to chronic overload. Post-viral syndromes and long COVID. Post-viral illness is one of the most magnesium-depleting states there is. Why? Because viral illness increases inflammatory demand, mitochondrial stress, nervous system activation, and electrolyte losses. People come out of viral illness feeling weak, shaky, anxious, exercise intolerant, and unable to regulate stress. And again, magnesium demand is high, but tolerance is low. This is where clinicians who understand regulation shine and protocol stackers fail. The big truth that most people miss is that modern chronic illness is not usually about one missing supplement. It's about a system that lost its ability to buffer stress. Magnesium is one of the primary buffering minerals, but buffers must be restored slowly, respectfully, in partnership with the body, not in opposition to it. What that means for you? If you are someone who reacts to supplements, feels worse before better, has been told you're too sensitive, has tried everything and still feels off, that doesn't mean you're broken. It means your system needs regulation before intensity. Magnesium is often part of the solution, but it must be introduced as support, not force. This is not about hacking the body. It's about restoring what modern life, chronic stress, and illness quietly stripped away. And when that restoration happens gradually, people don't just feel calmer, they feel safer in their own bodies.